Introduction. Welcome to the I Was You Project, an initiative dedicated to empowering and guiding at-risk youth toward a brighter future. Our mission is simple yet profound: to instill the values of hard work, respect for parents and authority, figures, and essential life skills that pave the way for these incredible individuals to become role models and productive members of society. In our commitment to shaping futures, we aim to provide a supportive environment that nurtures growth, cultivates positive habits, and fosters a strong sense of responsibility. Through mentorship, education, and engagement, we aspire to unlock the potential within each participant, equipping them with the tools they need to thrive. Module 3: The Importance of Safe Sex. When it comes to engaging in sexual activities, prioritizing safe sex is of utmost importance. Understanding the risks involved is key to protecting yourself and your partner from potential harm. Sexually transmitted infections, STIs, are a prevalent concern, with millions of cases reported each year. These infections can have serious health consequences, ranging from uncomfortable symptoms to long-term complications. Some common STIs include chlamydia, gonorrhea, syphilis, genital herpes, and human papillomavirus, HPV. Additionally, the risk of unintended pregnancies should not be ignored. Unprotected sex can lead to unplanned pregnancies, which may have significant emotional, financial, and personal implications for both individuals involved. Taking proactive measures to prevent pregnancy is crucial for those who are not ready or do not wish to have children at a particular stage in their lives. By practicing safe sex, you not only safeguard your own well-being but also demonstrate respect and care for your partner. Open and honest communication about sexual health is vital in maintaining a trusting and responsible relationship. Discussing sexual histories, getting tested regularly for STIs, and using appropriate forms of contraception are all important steps in protecting both yourself and your partner. Remember, safe sex is a shared responsibility. It is essential to stay informed about the risks associated with sexual activities and take the necessary precautions to ensure a healthy and enjoyable experience for all parties involved. Unintended consequences. In the context of sexual behavior, there are various unintended consequences that can arise from individual choices, societal norms, and public health initiatives. It's important to note that these consequences can manifest on physical, emotional, and societal levels. Here are some aspects to consider. 1. Sexually transmitted infections, STIs. Engaging in unprotected sex can lead to the transmission of STIs, including but not limited to HIV, chlamydia, gonorrhea, and syphilis. Lack of awareness or preventive measures can result in the unintended spread of infections. 2. Unintended pregnancies. Failure to use contraception or inconsistent use can lead to unintended pregnancies. This can have significant personal, emotional, and economic consequences for individuals and couples. 3. Relationship dynamics. Sexual interactions can impact the dynamics of relationships. Unplanned pregnancies or the contraction of STIs may introduce challenges that couples may not have anticipated, affecting emotional well-being and relationship stability. 4. Psychological and emotional impact. Unintended consequences of sexual activity may include emotional distress, guilt, or regret, particularly if the experience was not in line with personal values or expectations. 5. Cultural and social stigma. Societal norms and expectations surrounding sexual behavior can contribute to unintended consequences. Individuals may face judgment or discrimination based on their sexual choices, leading to emotional and psychological stress. 6. Reproductive rights and access to health care. Unintended consequences may arise from limitations on reproductive rights and access to sexual health services. Legal or social restrictions can impact individuals' ability to make informed choices about their reproductive health. 7. Gender dynamics. Gender inequalities can result in unintended consequences related to sexual behavior. Women may bear a disproportionate burden of unintended pregnancies or face social stigma, impacting their autonomy and well-being. 8. Cultural and religious influences. Cultural and religious beliefs surrounding sex can lead to unintended consequences. Taboos or restrictive norms may deter individuals from seeking information or accessing necessary healthcare services. 9. Education gaps. Lack of comprehensive sex education can contribute to unintended consequences. Insufficient knowledge about safe sex practices, contraception, and reproductive health may result in uninformed choices. 10. Public health impact. Unintended consequences in sexual behavior can have broader public health implications. High rates of STIs or unintended pregnancies may strain healthcare resources and contribute to the spread of infectious diseases. Sexually transmitted infections, STIs. Sexually transmitted infections, STIs, are infections that can be transmitted through sexual contact, including vaginal, anal, or oral sex. These infections are caused by bacteria, viruses, or parasites and can have a wide range of symptoms or may be asymptomatic. STIs pose a significant public health concern globally, and it's crucial to understand their transmission, prevention, and potential consequences. Here are key points to consider. Common types of STIs. Bacterial infections. Examples include chlamydia, gonorrhea, and syphilis. Viral infections. Common viral STIs include human papillomavirus, HPV, herpes simplex virus, HSV, HIV, human immunodeficiency virus, and hepatitis B and C. Transmission. STIs are primarily transmitted through sexual activities, including vaginal, anal, and oral sex. Some STIs can also be transmitted through blood or other bodily fluids. Symptoms. Symptoms vary widely depending on the type of STI. Many STIs may not show any symptoms, making regular testing important for early detection and prevention of complications. Testing and diagnosis. Testing for STIs involves various methods, including blood tests, urine samples, and swabs. Early diagnosis is critical for effective treatment and prevention of further transmission. Prevention. Safe sex practices, consistent and correct use of condoms can reduce the risk of STI transmission. Vaccination. Vaccines are available for certain STIs, such as HPV and hepatitis B. Regular testing. Routine testing is essential, especially for individuals with multiple sexual partners or those at higher risk. Treatment. Bacterial STIs are often treated with antibiotics. Viral STIs may have antiviral medications to manage symptoms, but many are not curable. Impact on reproductive health. Some STIs can lead to severe reproductive health consequences, including infertility, ectopic pregnancies, or complications during pregnancy. Global impact. STIs affect people of all ages, genders, and socioeconomic backgrounds. The global burden of STIs is significant, with millions of new infections reported each year. Stigma and mental health. Individuals diagnosed with STIs may face stigma and discrimination. The psychological impact of living with an STI, especially those with no cure, can affect mental health. Public health measures. Public health efforts focus on education, awareness, and accessibility to testing and treatment. Partner notification programs and contact tracing help prevent further transmission. Birth control methods. Barrier methods. Male condoms. Worn over the penis, condoms create a barrier that prevents sperm from reaching the egg, They also provide protection against sexually transmitted infections, STIs. Female condoms. Inserted into the vagina, female condoms offer a protective barrier and can be an alternative when male condoms are not preferred. Hormonal methods. Birth control pills. Oral contraceptives contain hormones, estrogen and progestin, that prevent ovulation and alter the cervical mucus to impede sperm movement. Birth control patch. This is a thin, adhesive patch applied to the skin, releasing hormones to prevent pregnancy. Birth control shot, Depo-Provera. This hormonal injection provides protection against pregnancy for several weeks or months. Birth control implant. A small rod is inserted under the skin, releasing hormones to prevent ovulation for up to several years. Intrauterine devices, IUDs. Hormonal IUD releases progestin to prevent fertilization and can provide protection for several years. Copper IUD acts as a spermicide, preventing sperm from reaching the egg. It is hormone-free and can be effective for up to 10 years. Permanent methods. Tubal ligation, a surgical procedure for women that involves closing or blocking the fallopian tubes to prevent the egg from reaching the uterus. Vasectomy, a surgical procedure for men that involves cutting or blocking the vas deferens, preventing sperm from reaching the semen. Natural methods. Fertility awareness-based methods, FAMS, tracking menstrual cycles, body temperature, and cervical mucus to identify fertile days and avoid unprotected sex during those times. Withdrawal method, pulling out, involves the man withdrawing his penis from the vagina before ejaculation. It is less reliable than many other methods. Emergency contraception. Emergency contraceptive pills, morning after pill, taken after unprotected sex to prevent pregnancy. It is not a regular form of birth control and should be used infrequently. Lactational amenorrhea method, LAM. This method relies on exclusive breastfeeding to delay the return of fertility. It is most effective in the first 6 months postpartum and requires strict adherence to specific breastfeeding practices. Cervical cap and diaphragm. These barrier methods are placed inside the vagina to cover the cervix and prevent sperm from reaching the uterus. Types of sexually transmitted infections, STIs, and their consequences. When it comes to sexual health, it is crucial to be aware of the different types of sexually transmitted infections, STIs, and the consequences they can have on both you and your partner. STIs are infections that are primarily transmitted through sexual contact, including vaginal, anal, or oral sex. They can be caused by bacteria, viruses, or parasites. One common STI is chlamydia, caused by the bacteria Chlamydia trachomatis. If left untreated, chlamydia can lead to serious health issues such as pelvic inflammatory disease, PID, in women, which can cause infertility. In men, it can result in epididymitis, a painful condition in the testicles. Other STIs caused by bacteria include gonorrhea and syphilis, both of which can have severe consequences if not treated promptly. Viral STIs include human papillomavirus, HPV, which can cause genital warts and increase the risk of certain types of cancer, such as cervical cancer in women. Herpes simplex virus, HSV, can also cause painful genital sores and can be transmitted even when there are no visible symptoms. Human immunodeficiency virus, HIV, is a viral infection that weakens the immune system, making individuals more susceptible to other infections and diseases. Acquired immunodeficiency syndrome, AIDS, is the advanced stage of HIV infection, and it can have devastating effects on one's health if not properly managed. Parasitic STIs such as pubic lice, crabs, and trichomoniasis can cause discomfort and itching in the genital area. These infections may not have long-term consequences but can still be unpleasant and require treatment. It is important to note that some STIs may not show symptoms immediately or may have mild symptoms that can be easily overlooked. Regular testing, using barrier methods such as condoms and open communication with your partner are essential for preventing the transmission and spread of STIs. Remember, being informed about the types of STIs and their consequences is a crucial step in protecting yourself and your partner. If you suspect you may have been exposed to an STI, seek medical advice promptly for diagnosis, treatment, and to prevent further transmission. Your sexual health is worth prioritizing and practicing. Safe sex is key in maintaining a healthy and fulfilling intimate life. Common STIs. Sexually transmitted infections, STIs, are infections that are primarily transmitted through sexual contact. They can be caused by bacteria, viruses, or parasites and can have a wide range of symptoms or may be asymptomatic. Chlamydia. Causative agent, Bacterium chlamydia trachomatis. Symptoms, often asymptomatic, but may include genital pain, discharge, and painful urination. Complications. Untreated chlamydia can lead to pelvic inflammatory disease, PID, in women and infertility in both men and women. Gonorrhea. Causative agent, Bacterium Neisseria gonorrhoeae. Symptoms, similar to chlamydia, including genital pain, discharge, and painful urination. Complications. If untreated, gonorrhea can lead to PID, infertility, and can spread to other parts of the body. Syphilis. Causative agent, Bacterium Treponema pallidum. Symptoms. Progresses through stages, with initial sores, followed by a rash, and potentially systemic complications if untreated. Complications. Untreated syphilis can lead to severe health problems, affecting the heart, brain, and other organs. Using barrier methods, condoms, dental dams, and gloves. When it comes to safe sex, using barrier methods is crucial in protecting yourself and your partner from sexually transmitted infections, STIs, and unwanted pregnancies. Barrier methods include condoms, dental dams, and gloves, each serving a specific purpose. Condoms are probably the most well-known and widely used barrier method. They provide a physical barrier between partners, preventing the exchange of bodily fluids and reducing the risk of STIs and pregnancy. Condoms come in various types, such as latex and non-latex, and can be used for both vaginal and anal sex. It's important to choose the right size and ensure they are stored properly to maintain their effectiveness. Dental dams are thin, flexible barriers made of latex or polyurethane that are used during oral sex. They provide a protective layer between the mouth and the genitals, reducing the risk of STIs. Dental dams are available in different flavors and can be easily purchased at drugstores or online. It's important to use a new dental dam for each oral encounter and to hold it in place securely. Gloves are commonly used during manual stimulation or when engaging in fisting. They provide a protective barrier between the hands and the genitals, minimizing the risk of transmitting or acquiring infections. Gloves should be made of latex or nitrile, as these materials offer the best protection against STIs. Like condoms and dental dams, gloves should be disposed of after each use. Using these barrier methods not only protects against STIs and pregnancy but also promotes open communication and trust between partners. It's important to discuss and agree upon the use of these methods beforehand to ensure both parties feel comfortable and safe. Remember, practicing safe sex is a shared responsibility, and using barrier methods is an essential part of that commitment. Condoms. Condoms are one of the most widely used and effective methods of contraception and protection against sexually transmitted infections, STIs. They are thin, sheath-like barriers made of latex, polyurethane, or polyisoprene, designed to be worn over the penis during sexual activity. Here are key points about condoms. Dual protection. Condoms provide dual protection by preventing unintended pregnancies and reducing the risk of sexually transmitted infections, including HIV. Materials. Latex condoms, most commonly used and highly effective. However, they are not suitable for individuals with latex allergies. Polyurethane condoms, suitable for individuals with latex allergies. They are thinner and conduct heat better than latex. Polyisoprene condoms, latex-free option, providing a natural feel similar to latex. Male and female condoms. Male condoms, worn over the penis, male condoms are the most common type. They come in various sizes, textures, and materials. Female condoms, inserted into the vagina, covering the cervix and lining the vaginal walls. They provide an option for individuals who prefer. Female-controlled methods. Correct use. Condoms should be used consistently and correctly for optimal effectiveness. Check the expiration date and open the condom carefully to avoid damage. Place the condom on the erect penis before any genital contact. Water-based lubricants. Water-based lubricants can enhance comfort and reduce the risk of breakage. Avoid oil-based lubricants, as they can weaken latex condoms. Size matters. Choosing the right condom size is important for comfort and effectiveness. Condoms that are too tight may be more prone to breakage, while loose condoms may slip off. Storage. Store condoms in a cool, dry place, away from direct sunlight. Avoid carrying them in wallets or pockets for extended periods, as heat and friction can weaken the material. Consistency is key. Use condoms consistently, not just when pregnancy prevention is a concern. Consistent use is crucial for protection against STIs. Emergency contraception. Condoms can be used in combination with emergency contraception, morning after pill, if there is a risk of unintended pregnancy after unprotected sex. Access and affordability. Condoms are widely accessible and available over the counter at pharmacies, health clinics, and many convenience stores. They are one of the most affordable forms of contraception. STI prevention. Condoms provide effective protection against a wide range of sexually transmitted infections, including HIV, gonorrhea, chlamydia, and herpes. Cultural and educational considerations. Promoting condom use requires cultural sensitivity and education about the importance of safer sex practices. Education campaigns play a crucial role in raising awareness about condom use. Dental dams. A dental dam is a thin, square or rectangular sheet typically made of latex, polyurethane, or polyisoprene, and it serves as a barrier method during oral sex. It provides a protective barrier between the mouth and the genitals or anus, reducing the risk of sexually transmitted infections, STIs, that can be transmitted through oral genital or oral anal contact. Here are key points about dental dams. Barrier protection. Dental dams act as a physical barrier to prevent the direct contact between the mouth and the genital or anal area. Materials. Latex dental dams, traditional option, effective but not suitable for individuals with latex allergies. Polyurethane or polyisoprene dental dams, latex-free alternatives for those with latex allergies. Size and shape. Dental dams are typically square or rectangular in shape and come in different sizes. They are designed to cover the genital or anal area during oral sex. Flavored options. Some dental dams come in flavored varieties to make the experience more enjoyable for both partners. How to use. Place the dental dam flat against the genital or anal area before engaging in oral sex. Hold the dental dam in place with hands or other means to ensure it stays securely in position. Water-based lubricants. Apply water-based lubricants to the side of the dental dam that will be in contact with the genitals or anus for added comfort. Safe sex practices. Dental dams are an important tool for practicing safe sex, especially when engaging in oral sex with a new or non-monogamous partner. STI prevention. Dental dams are effective in reducing the risk of STIs such as herpes, syphilis, and gonorrhea that can be transmitted through oral genital or oral anal contact. Easy accessibility. Dental dams can be purchased over the counter at pharmacies or obtained from sexual health clinics. They are an accessible and affordable option for safe sex practices. Communication. Open communication between sexual partners is crucial for ensuring the use of dental dams is consensual and comfortable for both parties. Educational resources. Education campaigns and sexual health resources provide information on the correct use of dental dams and the importance of safer sex practices. Alternative uses. While dental dams are primarily designed for oral sex, they can also be used as a barrier during certain sexual activities involving the fingers. Gloves. Gloves, in the context of sexual health, can refer to disposable latex or non-latex gloves used as a barrier during certain sexual activities. These gloves provide protection against the transmission of sexually transmitted infections, STIs, and can be employed in various intimate situations. Here are key points about the use of gloves in sexual health. Barrier protection. Gloves serve as a physical barrier between the hands or fingers and the genital or anal area, reducing the risk of STI transmission. Materials. Latex gloves, traditional option, effective but not suitable for individuals with latex allergies. Non-latex gloves, made from materials such as polyurethane or nitrile, providing alternatives for those with latex allergies. Size. Gloves are available in different sizes to ensure a proper fit for the wearer. How to use. Gloves should be worn on clean, dry hands. When used during sexual activity, they should be applied before any contact with the genital or anal area. Water-based lubricants. Applying water-based lubricants to the outside of the gloves can enhance comfort and reduce friction. STI prevention. Gloves are particularly useful for activities that involve manual stimulation or penetration, reducing the risk of STI transmission. Anal play. Gloves are commonly used in activities involving anal play to minimize the risk of tearing and provide a smoother experience. Safe sex practices. Incorporating gloves into sexual practices is considered a safe sex practice, especially when engaging in activities that involve direct contact with intimate areas. Communication. Open communication between sexual partners is important to ensure the use of gloves is consensual and understanding the effectiveness of different contraception methods. Understanding the effectiveness of different contraception methods is crucial when it comes to practicing safe sex and protecting both yourself and your partner. With so many options available, it's important to have accurate information to make informed decisions. One of the most effective methods of contraception is hormonal birth control, which includes options such as birth control pills, patches, injections, and implants. These methods work by releasing hormones into the body to prevent ovulation, thicken the cervical mucus, and prevent sperm from reaching the egg. When used correctly, hormonal birth control can be over 99% effective in preventing pregnancy. Barrier methods, such as condoms and diaphragms, provide a physical barrier between the sperm and the egg. Condoms are not only effective in preventing pregnancy but also in protecting against sexually transmitted infections, STIs. It's important to note that the effectiveness of barrier methods can vary depending on proper usage and the type of barrier method used. Intrauterine devices, IUDs, are another highly effective form of contraception. These small, T-shaped devices are inserted into the uterus and can provide long-term protection against pregnancy, ranging from 3 to 10 years, depending on the type of IUD. They work by either releasing hormones or creating a hostile environment. For sperm, preventing fertilization. It's also worth mentioning emergency contraception, commonly known as the morning after pill. This method can be used after unprotected sex or contraceptive failure to prevent pregnancy. However, it should not be used as a regular form of contraception and is most effective when taken as soon as possible after intercourse. When considering contraception methods, it's important to consult with a healthcare professional who can provide personalized advice based on your individual needs and health history. Remember, no method is 100% foolproof, and using multiple methods in combination, such as hormonal contraception and condoms, can provide additional protection against both unintended pregnancy and STIs. By understanding the effectiveness of different contraception methods, you can make informed choices that prioritize your sexual health and the well-being of your partner. It's essential to stay educated, communicate. Emergency contraception. Types of emergency contraception. Emergency contraceptive pills, ECPs, available over the counter or by prescription. These pills contain hormones, levonorgestrel or ulipristal acetate, that can prevent pregnancy if taken within a specific timeframe after unprotected sex. Copper intrauterine device, IUD. A non-hormonal IUD can be inserted by a healthcare provider within a few days of unprotected sex to prevent pregnancy. Effectiveness. The effectiveness of emergency contraception depends on the type used and how quickly it is taken after unprotected sex. ECPs are most effective when taken as soon as possible. Timing. Levonorgestrel emergency contraceptive pills, such as Plan B, are most effective when taken within 72 hours, 3 days, of unprotected sex, but they may still be effective up to 120 hours, 5 days, afterward. Ulipristal acetate emergency contraceptive pills, such as ELA, are effective up to 120 hours, 5 days, after unprotected sex. Copper IUD insertion can be done up to 120 hours, 5 days, after unprotected sex. Availability. Levonorgestrel emergency contraceptive pills are available over the counter without a prescription. Ulipristal acetate emergency contraceptive pills require a prescription. Copper IUD insertion must be done by a healthcare provider. Mechanism of action. Emergency contraception primarily works by preventing or delaying ovulation, making it less likely that an egg will be available for fertilization. Permanent methods. Tubal ligation, female sterilization. Procedure. Tubal ligation, also known as getting your tubes tied, involves closing or blocking the fallopian tubes to prevent the egg from reaching the uterus and being fertilized by sperm. Techniques. The fallopian tubes can be closed using clips, bands, or by cutting and tying the tubes. Invasive. Tubal ligation is typically performed through a small incision in the abdomen, laparoscopic surgery, but it can also be done after childbirth through a small incision near the navel. Effectiveness. Tubal ligation is considered a highly effective form of permanent contraception. While it is possible to reverse the procedure through tubal ligation reversal surgery, success rates vary. Vasectomy, male sterilization. Procedure. Vasectomy involves cutting or blocking the vas deferens, the tubes that carry sperm from the testicles. This prevents sperm from being ejaculated during sexual activity. Techniques. The vasectomy procedure can be performed by cutting the vas deferens or by sealing them through cauterization or with tiny clips. Minimally invasive. Vasectomy is a minimally invasive procedure that is often done in an outpatient setting. Effectiveness. Vasectomy is highly effective in preventing pregnancy. It takes some time, usually a few months, and a series of ejaculations to clear remaining sperm from the reproductive system after the procedure. Reversal. While vasectomy reversal is technically possible, success rates can vary, and it is not guaranteed to restore fertility. Important considerations for permanent methods. Irreversibility. Both tubal ligation and vasectomy are intended to be permanent, and reversal procedures are not always successful. Individuals should consider these methods only if they are certain they do not want future pregnancies. Counseling. Before undergoing permanent methods of contraception, individuals or couples are often required to undergo counseling to ensure that they fully understand the irreversible nature of the procedures. Contraceptive counseling. Individuals should receive comprehensive contraceptive counseling to explore all available options before choosing permanent methods. Health considerations. The decision to undergo a permanent method should take into account individual health, medical history, and personal circumstances. The procedures are generally safe, but like any surgery, they carry some risks. Natural methods. Calendar method, rhythm method. Principle. Based on tracking the length of menstrual cycles to predict fertile and non-fertile days. How it works. Determining the fertile window by recording the length of menstrual cycles over several months and avoiding intercourse during the estimated fertile days. Effectiveness. Effectiveness can vary, and it requires consistent and accurate tracking of menstrual cycles. It may be less reliable for women with irregular cycles. Basal body temperature, BBT, method. Principle. Based on monitoring daily basal body temperature, which typically rises slightly after ovulation. How it works. Recording temperature each morning before getting out of bed and avoiding intercourse during the temperature rise, indicating ovulation. Effectiveness. It requires precise tracking and consistency. It is more effective when combined with other fertility awareness methods. Cervical mucus method. Principle. Based on changes in cervical mucus throughout the menstrual cycle. How it works. Observing changes in the color, texture, and consistency of cervical mucus to determine fertile and non-fertile days. Effectiveness. It requires close attention to cervical mucus patterns and may be more effective when combined with other methods. Symptothermal method. Principle. Combines various fertility awareness methods, such as tracking menstrual cycles, monitoring basal body temperature, and observing cervical mucus changes. How it works. Integrating multiple signs of fertility to enhance accuracy in identifying fertile and non-fertile days. Effectiveness. It can be more reliable when multiple signs are considered, but consistent tracking is essential. Lactational amenorrhea method, LAM. Principle. Utilizes breastfeeding as a natural form of contraception during the postpartum period. How it works. Breastfeeding suppresses ovulation, providing a level of protection against pregnancy during the first 6 months postpartum. Effectiveness. LAM is most effective when specific criteria regarding breastfeeding frequency and absence of menstruation are met. Communicating with your partner about safe sex. Open and honest communication with your partner about safe sex is vital in establishing a healthy and responsible sexual relationship. It is essential to have these conversations before engaging in any sexual activity to ensure both you and your partner's well-being and protection. Start by creating a safe and judgment-free space for discussion. Initiate the conversation by expressing your concerns and intentions, emphasizing the importance of practicing safe sex for the sake of both individuals involved. Encourage your partner to share their thoughts, concerns, and any relevant medical history that may impact your decision-making process. Discussing contraceptive methods is a crucial aspect of this conversation. Explore various options such as condoms, birth control pills, intrauterine devices, IUDs, or implants. It's important to discuss the effectiveness, potential side effects, and personal preferences for each method. Additionally, consider discussing emergency contraception and its availability in case of any unexpected incidents. Another important topic to address is STI, sexually transmitted infection, testing. Both you and your partner should feel comfortable discussing your sexual history and previous experiences. Encourage each other to get tested regularly, as this not only ensures your safety but also promotes trust and honesty within your relationship. Consent should also be a key topic of conversation. Discuss boundaries, preferences, and establish clear consent guidelines to ensure that both partners are comfortable and enthusiastic about engaging in sexual activities. Remember, open and ongoing communication is essential. As your relationship progresses, continue to have conversations about safe sex and any changes in sexual health. Regularly check in with each other to ensure that both partners are still on the same page and comfortable with the decisions being made. By prioritizing communication about safe sex, you and your partner will establish a foundation of trust, respect, and responsible sexual behavior, fostering a healthy and enjoyable sexual relationship for both of you. Choose the right time and setting. Find a comfortable and private setting where both you and your partner can discuss sensitive topics without distractions or interruptions. Be open and honest. Express your thoughts and concerns openly. Encourage your partner to share their thoughts as well. Honest communication is essential for building trust. Use I statements. Frame your concerns or desires using I statements to avoid sounding accusatory. For example, say, "I feel more comfortable when we use protection," instead of, "You never use protection." Be respectful and non-judgmental. Approach the conversation with respect and a non-judgmental attitude. Acknowledge that everyone has their own comfort levels and boundaries. Discuss both STI prevention and contraception. Talk about the importance of preventing both unintended pregnancies and STIs. Discuss the methods you are comfortable with and explore options together. Educate each other. Share information about different contraceptive methods and STI prevention measures. It's an opportunity for mutual education and understanding. Ask about STI testing. Discuss the importance of regular STI testing, especially if you or your partner has had multiple sexual partners or if it's a new relationship. Getting tested together can reinforce a commitment to each other's health. Discuss birth control options. If applicable, talk about birth control options. Discuss the pros and cons of different methods and choose one that aligns with both of your preferences and lifestyle. Establish boundaries. Clearly communicate your personal boundaries and expectations regarding safe sex. Be open to hearing your partner's boundaries as well. Plan ahead. Plan for safe sex ahead of time. Keep condoms or other contraceptives easily accessible so that using them becomes a natural part of your sexual routine. Consent, boundaries, and practicing safe sex. Consent, boundaries, and practicing safe sex are essential aspects of any healthy sexual relationship. It is crucial to prioritize open and honest communication with your partner about your desires, boundaries, and comfort levels. Consent should never be assumed but rather actively and continuously sought throughout any intimate encounter. Establishing clear boundaries and respecting them is equally important. Boundaries can include personal preferences, limits, and comfort levels regarding various sexual activities. Each individual has the right to define their own boundaries and should feel empowered to communicate them without fear of judgment or pressure. Practicing safe sex is not only about preventing unwanted pregnancies but also about protecting oneself and one's partner from sexually transmitted infections, STIs. It is vital to educate oneself about different methods of contraception and STI prevention, such as using condoms, dental dams, or getting vaccinated against certain infections. Regularly getting tested for STIs is a responsible and necessary step to ensure both partners' health and well-being. Openly discussing STI testing with your partner can Help build trust and foster a safer sexual environment. Remember, consent, boundaries, and practicing safe sex are ongoing conversations that should be revisited and respected throughout the course of any sexual relationship. By prioritizing these aspects, you can create a safer and more fulfilling sexual experience for both yourself and your partner. Consent. Definition of consent. Consent is the voluntary, enthusiastic, and mutual agreement to engage in sexual activity. It should be continuous and can be withdrawn at any point. Communication. Open communication is essential. Discuss desires, boundaries, and expectations with your partner before engaging in any sexual activity. Verbal and non-verbal cues. Pay attention to both verbal and non-verbal cues. Verbal affirmation is important, but also be attuned to body language and non-verbal signals. Mutual enthusiasm. Both partners should express genuine enthusiasm and a positive willingness to participate. Silence or passivity does not imply consent. Consent is not assumed. Consent cannot be assumed based on past experiences or the nature of the relationship. Each instance of sexual activity requires explicit consent. Practicing safe sex. Use barrier methods. Consistently use barrier methods such as condoms to reduce the risk of sexually transmitted infections, STIs, and unintended pregnancies. Communication about protection. Discuss the use of protection with your partner before engaging in sexual activity. Agree on the type of protection to be used. STI testing. Regularly undergo STI testing, especially if you have multiple sexual partners. Encourage open communication about STI status with your partner. Birth control. If applicable, discuss and decide on a reliable form of birth control that suits both partners. Understand the options available. Emergency contraception. Be aware of emergency contraception options in case of contraceptive failure or unprotected sex. Discuss a plan with your partner. Consent to safe sex practices. Consent should extend to safe sex practices. Agree on the use of protection and communicate about any changes or preferences. Education. Stay informed about sexual health, contraception, and STIs. Knowledge empowers individuals to make informed choices. Regular health checkups. Schedule regular health checkups, including sexual health screenings. Prioritize your overall well-being. Discuss sexual health history. Discuss sexual health history, including past STIs, with your partner. Honesty about health status contributes to a safer sexual environment. Consent to health decisions. In case of unexpected situations, such as contraceptive failure or exposure to STIs, be prepared to make joint health decisions. Discuss and agree on a plan. Tips for making safe sex enjoyable and pleasurable. Safe sex is not just about protecting yourself and your partner from sexually transmitted infections and unintended pregnancies, but it's also about ensuring that the experience is enjoyable and pleasurable for both parties involved. Here are some tips to make safe sex a pleasurable experience. 1. Communication is key. Before engaging in any sexual activity, have an open and honest conversation with your partner about your boundaries, desires, and preferences. This will help create a comfortable and consensual environment where both partners can express their needs and desires. 2. Use high-quality condoms. Condoms are an essential tool for safe sex. Choose condoms that are made of latex or polyurethane and are properly labeled for their effectiveness in preventing STIs and pregnancies. Make sure to check the expiration date and use a new condom for each sexual encounter. 3. Experiment with different condoms. Condoms come in various sizes, textures, and flavors. Don't be afraid to explore different options to find the one that suits you and your partner's preferences. This can add an extra element of excitement and pleasure to your intimate moments. 4. Incorporate lubrication. Using lubrication can enhance the pleasure of safe sex. It reduces friction and discomfort, making the experience more enjoyable. For both partners, choose water-based or silicone-based lubricants that are compatible with condoms to ensure their effectiveness. 5. Explore different forms of contraception. While condoms are highly effective, it's important to consider other forms of contraception, such as birth control pills, IUDs, or implants, to further reduce the risk of unintended pregnancies. Consult with a healthcare professional to find the most suitable option for you. 6. Educate yourself about sexual pleasure. Understanding your own body and what brings you pleasure is crucial. Explore your own sexuality through self-exploration or with your partner. Communicate your desires and fantasies, and be open to trying new things that can enhance pleasure and intimacy. During safe sex, remember, safe sex doesn't have to be dull or uncomfortable. By prioritizing communication, using high-quality protection, and exploring different ways to enhance pleasure, you can have a safe and enjoyable sexual experience with your partner. Addressing common misconceptions and myths about safe sex. Addressing common misconceptions and myths about safe sex is crucial in promoting a healthy and responsible approach to sexual relationships. Unfortunately, there are numerous misconceptions that continue to circulate, leading to potential risks and misunderstandings among individuals. One common misconception is that using 2 condoms provides double the protection. In reality, using 2 condoms can actually increase the chance of them tearing due to friction. It is always recommended to use a single condom correctly, along with additional forms of contraception if desired. Another myth is that you don't need to use protection if you're in a committed relationship or if you and your partner have both been tested for STDs. While trust and open communication are essential in any relationship, it is important to remember that STDs can still be transmitted even if both partners have been tested in the past. Regular testing, along with consistent and proper use of protection, is crucial for maintaining sexual health. Additionally, some individuals believe that certain sexual acts, such as oral sex, are completely safe and do not require the use of protection. However, it is important to note that STDs can still be transmitted through oral. Using dental dams or condoms during oral sex can significantly reduce the risk of transmission. Educating oneself and dispelling these misconceptions is essential for promoting safe and responsible sexual practices. It is crucial to rely on accurate information from reputable sources, such as healthcare professionals or reliable sexual health websites. By addressing and debunking these myths, individuals can take the necessary steps to protect themselves and their partners, ensuring a safer and healthier sexual experience. 1. Myth: I can't get pregnant or contract STIs on the first time. Fact: unprotected sex, even the first time, carries the risk of both unintended pregnancies and STIs. It only takes one instance of unprotected intercourse to expose individuals to these risks. 2. Myth: pulling out is an effective form of contraception. Fact: the withdrawal method, pulling out, is not a reliable form of contraception. Pre-ejaculate, pre-cum, can contain sperm, leading to the risk of pregnancy. It also provides no protection against STIs. 3. Myth: I can't get an STI if I'm in a monogamous relationship. Fact: while being in a monogamous relationship can reduce the risk of some STIs, it does not eliminate the risk entirely. STIs can be present even in seemingly monogamous relationships, and regular testing is important. 4. Myth: birth control pills protect against STIs. Fact: birth control pills are effective in preventing pregnancy but offer no protection against STIs. Barrier methods, such as condoms, are essential for reducing the risk of STI transmission. 5. Myth. You can't get pregnant during menstruation. Fact. While the probability is lower, it is still possible to get pregnant during menstruation. Sperm can survive for several days in the reproductive tract, and the timing of ovulation varies among individuals. 6. Myth. Only high-risk individuals get STIs. Fact. Anyone who engages in sexual activity can be at risk for STIs. The concept of high risk can be misleading, as anyone, regardless of age or relationship status, can contract an STI,